The first question is here. The nurse assists with the birth of a newborn. Which nursing action is the most effective in preventing the heat? So the examiner make the question is easy for you because there are two key points. One is newborn and other is the question about the prevention heat. So newborn prevention heat is very important. Otherwise, patient develop hypothermia or cold. If they catch the cold, patient newborn will face so many complications like infection, fever, hypothermia. So how to prevent the hypothermia or heat loss out of these four, which is the most effective, right? So they said warming the bed or closing the door to the room. Also, dyeing the infant with a warm blanket. Definitely out of four, this one makes sense. Like the newborn with a lot of secretion, amniotic fluid or other secretion, first of all, we have to make dry, right, with a warm blanket. So turning the overhead radiant warmer, but it is the most important one first. If babies get wet, it will not good for the baby, right? So what is their explanation? They said the evaporation of a moisture from a wet baby heat along with the moisture. So keeping the newborn dry by dyeing the wet newborn at the bath prevent hypothermia. So prevention hypothermia or heat loss or prevent to catch cold is the most priorities. And if the babies get wet after delivery, we make them die, right, with a warm blanket. What the next question? That question here, mother of a newborn call the clinic and report that when cleaning the umbilical cord, notice that the cord are moist and discharge is there present. What are the most appropriate nursing instruction to the mother? So when mother cleaning the umbilical cord, mother found it is moist and something is discharged from the umbilical cord. It is very important because the infection is most common in that level. When infection, umbilical cord will be red, swollen, increase the local temperature, and discharge something, right? And also the moisture. So infection prevention is the most priorities, or we have to take the necessary action, like maybe baby needs antibiotics. Who knows? So if mother complain this one, which out of four, which one should be the most priorities or action we should appreciate? So first one, they said bring the infant to the clinic, right? And then this is the normal occurrence, no further action needed, no discharge occur, right? And moist, it is not normal. Increase the number of time that code and clean the per day, but you have to check it. Monitor the cord for next 24 to know it is not a good option. Definitely good option to assessment. So assessment is the nursing process, the first steps of nursing process. But how you do the assessment? Tell mother to bring the baby to the clinic, right? So this is the good choice out of 4. So what is their rationale? The sign of umbilical cord infection are moistness, oozing, something discharge, or redness. If the sign of infection occur, the client should instructed to notify the healthcare provider. If these symptoms occur, antibiotics may be necessary. But first of all, I said assessment is important. Then go for nursing diagnosis or further intervention. It is the good choice. The question number 3, the nurse assigning a newborn after circumcision, and note that the circumcised area is red with a small amount of bloody discharge. Which nursing action the most priorities? There are 4 options. Which one are the most priorities? So newborn circumcised. So circumcision means the foreskin is removed from the glans penis. So at the healing process, at the first few hours, the tip of the penis should be the red. It is nothing abnormal. It is normal healing process. Even some discharge, bloody discharge is normal. And then gradually the discharge will be stopped, and the other secretion like yellowish secretion will become is also normal next 24 hours. If the bloody discharge for more hour, longer hour, this is abnormal. So whatever it is, because of our enough clinical skill, we have to deal with the patient. If any kind of emergencies, we have to notify to the healthcare provider, right? According to this question, we can say after circumcision or circumcision, note that the area is red and small. You see the small amount of discharge. Nothing abnormal. It is red little bit and small amount of blood discharge. Nothing mentioning that the huge amount, swollen, pain, fever, nothing mentioning here. Only the 2 point red and small amount of blood discharge. It is a normal process. So which is the action? Apply gentle pressure. It does not make any sense. Or reinforce the dressing. Number 2 is not bad, but let me read 3 and 4. Document the findings and contact the healthcare provider. We have to observe more. If any other complication like increase the temperature, more swelling, pain, huge amount blood discharge, sign of infection, fever, then you have to notify healthcare provider. But this condition need to observe, and nothing mentioning here for observation. And I said number 4 is not an answer because this is a stable condition. Out 1 is not an answer. I said it does not make sense. Number 2 and 3. So to reinforce the dressing, but whatever happening, I have to keep the documentation, because documentation can save the patient, documentation can save you. And you also compare what you see before and what next. So I said in that scenario, it is good choice if you keep the record, means documentation first. If condition is so bad, we inform the healthcare provider, but condition is not that much bad, right? Out of here, the number 3 is a good choice. So already, let me see their rationale, what they said. They said the penis is normally red during the healing process after circumcision. You see, the normal findings. Yellow exudate may be noted in next 24 hours, and this is the part of normal healing. The healthcare provider would expected that the area would be red with a small amount of bloody drainage. Only if the bleeding were excessive would be nurse apply the gentle pressure, but bleeding is not too much. Already questions a small amount of bleed. If it is huge amount, we give them pressure on the bandage. If only bleeding were excessive, would the nurse apply the gentle pressure with a dressing? If the bleeding cannot be controlled, the blood vessel may need to ligate, and the nurse would notify healthcare provider because the findings identify the question are normals, and nurse would document the assessment findings. So a good documentation is always important. So what we do in the hospital, definitely keep the documented first. The question, the nurse in a newborn nursery is monitored a preterm newborn for respiratory distress syndrome. So which assessment finding should alert the nurse to possible of this syndrome? So the question is make easy because clearly response mentioned here, the newborn respiratory distress syndrome. So if you know what are the sign and symptom of the newborn respiratory distress syndrome, it would be easy to answer, right? So infant respiratory distress syndrome, it is the sometimes we call respiratory distress syndrome only. The baby who have it, they have a breathing disorder because of immature lung. Okay, so the basic symptom of this patient have shortness of breath and their lungs does not expel well. So let me read the answer and decide what it is. First of all, cyanosis. If the baby has a shortness of breath, means the tissue will not get enough oxygen because of constriction the alveoli. Definitely patient develop the cyanosis, blue baby, right? So if any patient have a COPD or bronchial asthma or respiratory distress syndrome, they have they can difficulty of breathing, we call shortness of breath or dyspnea. If anybody is dyspnea, definitely they will be develop anxiety, increase the palpitation, and all of this lead to develop increase the heart rate, we call tachycardia. So just imagine if you are suddenly sick today, at least you are not feel good, you are not mentally stable. When patient has a shortness of breath, difficulty of respiration, they undergo anxiety, they undergo the restlessness, increase the palpitation, all of them lead to increase the heart rate, we call tachycardia. Hypotension. There are no relationship with respiratory distress syndrome and hypotension. No relationship. Retraction. Yes. Our major muscle in respiration are diaphragm. But when patient has a difficulty of respiration, our accessory muscle participate in respiration like sternocleidomastoid intercostal muscle. So intercostal muscle is go in and out, and there's some depression in between the ribs, we call retraction. It is also common sign if patient have a respiratory distress syndrome. Audible grunt, also the sign of acute respiratory distress syndrome. Presence of a barrel chest, it does not necessary. The patient have to have the presence of barrel chest. It does not necessary, I said, right? So what is their explanation? Basically, if you know the respiratory distress syndrome and sign and symptom, it would be easy for you to answer the question. So a newborn infant with a respiratory distress syndrome may present with the clinical sign of cyanosis, tachycardia, or apnea, nasal flaring, chest wall retraction, and also audible grunt. Hypotension and barrel chest are not related or not clinical manifestation with respiratory distress syndrome. So always keep in mind when you work in the pediatrics unit, the newborn care is important. Like we have to check the airway. If any secretion in the airway, suction the mouth. Sometimes NCLEX board asks, when you go to the suction, the upper respiratory tract, which one you have to suction first, mouth or nose? Suction mouth before the nose. It is important. What are the next question? The postpartum nurse is provide instruction to the mother of a newborn with hyperbilirubinemia. So after the birth, some of the babies bilirubin level go up and they develop the jaundice. It is normal and we called physiological jaundice. So every student must know what are the normal findings of the newborn. So if baby have a physiological jaundice, we must keep them under observation. If physiological jaundice is continue and develop pathological jaundice, definitely we will intervention. But at the beginning, we have to observe the baby who have hyperbilirubinemia, who is being breastfed. So breastfeeding, very important after the delivery. The nurse should provide which instruction to the mother, right? So when a baby born, within 2 hours, we should encouraging the mother to go for the breastfeed. Keep in mind, during breastfeeding, you could encouraging mother to take 2,700 to 2,300, or some books say 3,000 calorie intake every day, and also 3,000 milliliter fluid intake, right? If they are continue the breastfeed. So it is very important. So now here, the feed of the newborn less frequent. Continue breastfeed every 2 to 4 hours. Switch the bottle feeding. Stop the breastfeed and switch to bottle permanently. So this baby has a hyperbilirubinemia. Maybe it is physiological. Patient maybe develop jaundice. Patient is being breastfed. We do not need to switch in bottle feeding. No, never ever. So number 3 and number 4 is never ever the answer. Feed newborn less feeding. Why? Why less feeding? Is it any beneficial effect if feeding less? So what are the normal breastfeeding, like 2 to 4 times? We could continue it, right? Something is important I want to share with here. Let me see the answer first. I say the normal breastfeed here. What the rationale? Hyperbilirubinemia is an elevated serum bilirubin level. At any serum bilirubin level, the appearance jaundice during the first day of life and indicate a pathological process. Early and frequent breastfeeding or excretion the bilirubin. Breastfeeding should be initiated within 2 hours and every 2 to 4 hours, right, thereafter. So after started, it should be continued every 2 to 4 hours. The infant should not be fed less frequent, never switching to bottle feeding. It does not make any sense. Sometimes NCLEX board asks a question, what medical condition mother not to give the breastfeed their baby? Means contraindication to the breastfeeding. What condition? If mother have a tuberculosis, if mother has a breast cancer, if mother under chemotherapy, if mother have a hepatitis or HIV infection, if mother take any medication like methotrexate, or if the baby or infant has a lactose intolerance. In that condition, it is good not to give the breastfeed. As I told you, sometimes NCLEX board asks, what are the contraindication of breastfeed? Or breastfeeding include but not limited to. So in what medical condition mother are not allowed to give the breastfeed to their baby? If mother have a tuberculosis, if mother diagnosed HIV, if mother have a breast carcinoma or cancer, if mother have a chemotherapies, if mother under chemotherapy or radiation therapy, it is good not to continue the breastfeed after delivery. If mother take some medication like methotrexate or lithium is a mood stabilizer, and methotrexate is a chemotherapeutic agents. All of these are the mother condition. What are the infant? If infant have a lactose intolerance, that times it is also contraindication of breastfeeding. The question, the nurse assessing a newborn who was born to a mother who is addicted to the drugs, which findings should the nurse expected to note during the assessment of newborn? So if mother are addicted to the drugs, the baby have a chance to develop some medical condition, some malformation, and also what are the sign and symptom we can assessment, right? What are the common sign here? Let me say lethargy and sleepiness or irritability, constant crying, difficult comfort, and also the being cuddled when being held. So lethargy or sleepiness is not the sign the baby who born of a woman who used to or addicted to drugs. Irritabilities, it is the sign that this kind of baby easily get disturbed, or we called overloaded. Constant cry, this is also the positive sign. Difficult to comfort, this is sign 2. Also cuddle when being held is not an answer. So I said it is we have to learn here the newborn with the women who used during irritation, the infant is overloaded easily by sensory stimuli. So they are irritability is most common. The infant may cry and also difficult to console, or means difficult to comfort. Infant would hyperextended or posture rather than the cuddle when being held. And this type of baby do not have the sign symptom of lethargy or sleepiness. What next? Question here, the nurse note hypotonia, irritabilities, and poor suction reflex in a full-term newborn on admission to the nursery. So when RN assessment the baby, she found the baby is a hypotonia, irritabilities, and poor sucking reflex, right? So if all of this, like, and she diagnosed the baby suspected fetal alcohol syndrome, is aware that which additional sign would be considered with this syndrome, right? So this baby is very unfortunate because the mother during the pregnancy, she intake too much alcohol. She was addicted to alcohol, and baby born with fetal alcohol syndrome or drug addiction. And this type of baby have some common sign and symptom, like the poor body weight, or they easily sneezing, small head, or also the facial abnormalities. So number one, length is 19 inches. So length is 19 inches, they said. And then abnormal palmar crease, right? So the third one, body weight is 6 pounds or 14 ounce. Head circumference approximately gestational age. So out of 4, which one is support the fetal alcohol syndrome and which one is the normal sign? Like number 1, length is 19 inches. It is normal. It is normal sign. And also abnormal palmar crease. It is the sign what support the fetal alcohol syndrome. And normal length of the baby is 18 to 21 inches. Body weight is 6 pounds, right? But normal body weight is 6 to 8 pounds, so it is also normal. So the baby who is small for gestational age, their body weight must be less than 5 pounds. The baby who is large or gestational age, their body weight must be more than 8 pounds, right? So it is normal as well. Number 3, head circumference approximately for gestational age. Already it is mentioning head circumference is okay, but normal head circumference is 33 to 35 centimeter or 13 to 14 inches. Okay, so only one abnormal sign we found here, abnormal palmar creases. Definitely it is our choice. What are the rationale? So fetal alcoholic syndrome, a diagnostic category of fetal alcohol spectrum disorder, and is caused by maternal alcohol use during the pregnancy. Basically, mother is addicted to the alcohol and baby develop fetal alcohol syndrome. And the sign symptom of it, the newborn diagnosed with this problem, the sign symptom include craniofacial abnormalities, facial dysmorphism, or intrauterine growth retardation, cardiac abnormalities, and abnormal palmar crease. Even patient develop with respiratory distress. So every student must know what are the normal newborn findings, right? The question here, the nurse is creating a plan of care for a newborn who is diagnosed with the fetal alcohol syndrome. The nurse should include which priority intervention, the plan of care. So if during the pregnancy, if mother are addicted to alcohol, the infant have a chance to develop with the some sign and symptom or problem we call fetal alcoholic syndrome. So already patient is diagnosed by this. What are the first priority? There are 4 options we mentioning here. What we could do first, right? So allow the newborn to establish own sleep rest pattern. Sleeping and rest is important, but is it the priority for this patient? Because sleep or tired, this is not related to the fetal alcoholic syndrome. Maintain the newborn bright light. Definitely this is not answer. Always give them quiet room. Encouraging frequent handling newborn by staff or parents. Encourage the frequent handling. So it is not necessary. It does not make sense. Frequent handling, it how can help it? Monitor the newborn response to feeding and weight gain. So usually the fetal alcoholic baby have one problem. They have a poor body weight gain because of nutrition. They also less sucking reflex, right? So nutrition is most challenging. So your baby who have the fetal alcoholic syndrome, they are eating well or not, it is important to take care of them, right? So nursing intervention, okay? Out of this four option, we chose number 4 because of the provide enough nutrition. And we already found one problem is there, we call weight gain or not, response of feeding. Because they have a lackings or sucking reflex or swallow capability is not like the normal baby. So it is the concern. So what are the rationale they said? Fetal alcoholic syndrome diagnostic category under the fetal alcoholic spectrum disorder caused by maternal alcohol use during the pregnancy. The primary nursing goal for the newborn diagnosed with fetal alcoholic syndrome is to establish nutritional balance after the birth. This newborn may exhibit hyperirritabilities, so we do not need bright light, or nausea, vomiting, and diarrhea. They also poor sucking reflex or swallowing ability is not good. So in that scenario, they have a chance of undernutrition. The quiet environment with minimal stimuli is important here, and also take care of the nutrition. What next? The nurse admin erythromycin ointment 0.5% to the eye of a newborn, and the mother asks the nurse why this is performed. Which explanation the best for the nurse to provide about the neonatal eye prophylaxis? In this question, the antibiotic name erythromycin, right? So erythromycin ointment, when we give, it is the antibiotic. So erythromycin eye ointment we give to prevent the chlamydia infection or gonorrhea infection in the neonatal life. So mother may be some infection during the pregnancy. So it is give this medication as a prophylaxis to prevent either chlamydia or gonorrhea, right? So what basically we do? So in the first trimester or second trimester or third trimester, we go for some diagnostic test. It is very important. Like the first trimester, we go for rubella scanning, HIV scanning, or VDRL, Venereal Disease Research Laboratory Test, VDRL, or TB test, urine analysis. So we try to find out mother have any disease or not. In the third trimester, also we check the STD testing or scanning, right? Very important to save the baby. So now here, baby is going to get this one. Maybe mother have the gonorrhea, so that they need it. Out of 4, which one is the best to respond? Protect the newborn eye from possible infection acquired with hospital. So no, there are no chance baby will get chlamydia or gonorrhea from hospital. Maybe pneumonia is okay. And for the pneumonia, we do not use the erythromycin. Prevent the cataract. It is nothing related to the cataract, right? Nothing related to the lens of the infant. Minimize the spread of microorganisms to the newborn from invasive procedure during the labor. What microorganism? Spreading during the labor. Definitely the erythromycin, not for the antibiotic to spread the microorganism prevention during the delivery process. Prevent the infection called ophthalmia neonatum from occurring after the birth in a newborn to a woman with a untreated gonorrhea infection. As I told you, erythromycin ointment we give to prevent either chlamydia infection or gonorrhea infection. Chlamydia and gonorrhea both are sexually transmitted infection, and infant get this infection from the mother, we call vertical infection, transmit from mother to newborn, right? So mother was untreated. So the newborn, when came in the world, we gave them ophthalmic ointment. We call erythromycin ointment. So answer 4 is one of the best choice out of all. So what are their rationale? So erythromycin ointment or ophthalmic ointment are used as a prophylaxis treatment for ophthalmia neonatorum, which is caused by bacteria Neisseria gonorrhoeae. So Neisseria gonorrhoeae is an organism that can cause the gonorrhea, right? So preventive treatment of gonorrhea is required by the law, basically. So we use ophthalmic ointment. We call erythromycin ointment.